So, welcome to the Bridging Oral Health and Non-Communicable Disease podcast from the World Federation of Public Health Associations. I'm your host, James Mckeown from Ghana, a global health practitioner, and also General Secretary for Ghana Public Health Association. I'm also a member of the NCD working group for the Federation as well. Every episode of our series explores how oral health connects with different non-communicable diseases. In our previous episode, which was moderated by Prof. Prajjwal, we discussed overcoming challenges in tobacco control. Today, we are going to discuss the topic bridging oral health and diabetes. Diabetes is one of the leading causes of mortality and morbidity globally, with over 800 million adults living with the disease in 2022. In 2021, more than 2 million diabetes-related deaths were recorded globally, as reported by the WHO. Diabetes poses enormous burden on global health, and its impact on health financing is huge, with approximately 12% of global health expenditure spent on diabetes care. There are millions of people living with complications of diabetes, such as blindness, kidney disease, cardiovascular disease, among others. So in this episode, we'll be talking about the burden of diabetes and explore how creative ways of overcoming this disease. This topic is very relevant and it will benefit everyone who is listening, as I'm hoping that all of us will go through this podcast and to the end. For our guest today, I'll be joined by two distinguished individuals who are experts in the topic, and they will be helping me discuss this topic. First of all, let me introduce to you Dr. Sangeeta Singh. Dr. Sangeeta is an experienced periodontist and a global health practitioner with skills acquired over two decades in military leadership, academic and leadership roles. She has wide-ranging global health interests, which mirror the complexities in global health space, with experiences from clinical, subnational, national, and international context. With over 23 years of military experience spanning clinical dentistry, research, and academia, she brings a unique blend of practical expertise and leadership. She holds a master's degree in periodontology and a master's in global health policy from the London School of Economics. She has 4 research projects on oral health as principal investigator and 22 publications to her credit. She is the recipient of the Best Research Project in Oral Health for the Armed Forces in 2019. She's an examiner in periodontics for the Global Royal of Surgeons, Edinburgh, and is currently contributing as an expert member for WHO technical paper on diabetes and oral health. Dr. Singh, you are welcome if you can hear me.
Thank you so much.
Thank you. Our next speaker is Professor Robin Maskey. Prof. Robin is currently a professor of internal medicine and chair of fellowship of endocrinology at Pyakurel Institute of Health Sciences in Nepal. He graduated from medical school at the MCOMS, Nepal, internal medicine from BPJIHS, postgraduate training in NUHS Singapore, and fellowship in endocrinology in India. Prof. Robin serves in different leadership capacities in many professional organizations. He is a past president to chairperson of Diabetes Endocrinology Association of Nepal. Professor Robin is actively engaged in clinical and administrative work at internal medicine and division of endocrinology at BPJIHS in Nepal. He's also an executive board member of International Society of Endocrinology from 2024 to 2028. He has fellowship of FICP India, FRCP Edinburgh, UK, and FACP USA. He's a member of the AAC also. His major research interests include diabetes, thyroid, and reproductive endocrinology. He has published over 103 international papers and books chapters as well. He regularly performs editorial review work for international journals and grants panels in the field of internal medicine and endocrinology. Prof. Robin, I'm happy to see you. How are you?
I'm good, I'm fine. Thanks for a nice introduction.
Thank you so much, Dr. Singh, and also Prof. Robin, for joining us for our discussion today. So let me start, first of all, with Dr. Sangeeta. What is diabetes and how does it connect with oral health? As answer this question, also please help us to understand why should this relationship matter to public health professionals and community health programs.
Yeah, thank you, James, and happy to start. So diabetes is a chronic disease characterized by high blood sugar levels. It occurs either when the body doesn't produce enough insulin, a hormone responsible for regulating blood glucose, or when the body cannot effectively use the insulin it produces. It affects nearly 828 million people worldwide, and these figures are expected to touch 1.3 billion by 2050. Oral disease are even more prevalent, affecting nearly 3.5 billion people globally. Dental caries, periodontal diseases, tooth loss, oral cancers, and other oral conditions represent a substantial proportion of the global disease burden, particularly in people living with diabetes. The high prevalence of both diabetes and oral diseases underscores a critical intersection in healthcare of high complexity and clinical challenge. Diabetes results in a state of raised blood sugar or hyperglycemia, which, if uncontrolled, can lead to serious damage across various body systems. And over time, uncontrolled diabetes can damage nerves, blood vessels, the heart, kidneys, and eyes. But what might surprise you is how closely connected it is to oral health. These conditions are linked through systemic inflammation and shared risk factors, including old age, smoking, and lower socioeconomic status. In addition, both the conditions are often interconnected and may exacerbate one another when not managed effectively. Moreover, both diabetes and oral diseases like dental caries share common risk factors, especially diet. High intake of free sugars not only promotes dental caries, but also contributes to obesity and insulin resistance, which are risk factors for developing diabetes. And here's why this connection matters from public health perspective. Oral diseases are largely preventable and manageable when caught early. By promoting good oral hygiene and reducing sugar intake, we can prevent or reduce the severity of both oral diseases as well as diabetes. Prevention, early detection, and integrated care are key to improving health outcomes on both individual and community levels. Thank you.
Thank you very much for this explanation, which means that diabetes is very important. And as for the oral health community, once we're able to take control of diabetes, we can also reduce many of the complications that we see in oral health. Let me come to Prof. Robin as we explore more on the risk factors for diabetes. So, Prof. Robin, what are some of the causes of diabetes? And how does lifestyle factors such as diet, physical activity, and social determinants like income, education, access to care influence diabetes risk?
Thank you, James, for wonderful questions. So, as Dr. Sangeeta has already told, the global burden of diabetes is increasing, and the risk factor of diabetes or causes of diabetes can be divided as per the classification of diabetes. So, ADA has classified diabetes as type 1, type 2, or gestational diabetes mellitus. So, as you all are aware, that type 1 diabetes are mostly due to the genetics and autoimmunity that destroy the pancreatic cells, beta cells, and the autoantibodies are occurs due to the various environmental factors also. And whereas the type 2 diabetes and gestational diabetes are more lifestyle related risk factors that leads to the diabetes like diet, weight, and physical inactivity. But in Southeast Asian countries like Nepal, India, there are some ethnic backgrounds and medical conditions which I am dealing with one by one. So we all South Asians are having thrifty phenotype genes. So we are more prone for obesity and insulin resistance and early type 2 diabetes than the Western or European people. And what are the lifestyle and personal risk factors? So weight, as you have a poor oral intake, poor diet, especially low fruits, vegetable, and if you are taking more of high fat diet, glucose, high sugar diet, that will cause the weight gain, overweight, and these are leading to insulin resistance and causing diabetes. So as we age also, there's a more increase of chance of having diabetes more than 45 years of age as per the American Diabetes Association guidelines, and it can occur more often in our ethnic like Southeast Asian because tryptophan phenotype, it can occur at age of more than 20 years of also. And history of gestational diabetes is also one of the important causes for the diabetes. So if the pregnant woman with the gestational diabetes and she has given birth to a 4 kg weight baby, she are more risk for or she can have a diabetes in later year. And the person with the hypertension, blood pressure, high cholesterol level, person with smoke, and person most neglected part nowadays is the chronic stress. This chronic stress are also causing the high cortisol level and causing diabetes. And another important fact which I am telling is children's they are more prone for type 1, they are more prone for diabetes because of autoimmunity like viruses can attack on the beta cells and cause autoantibodies causing the destruction of beta cells and decrease insulin deficiency. And also when children are fed with the cow milk like bovine proteins is there, it will act on the beta cell and causes the antibody production and destroy the pancreatic beta cells. Some various autoimmune conditions like thyroiditis or celiac disease can be also associated with the type 1 diabetes. And there are newly coming medical conditions like MAFLD, or metabolic associated obesity, fatty liver, steatohepatitis, or polycystic ovarian syndrome can also be the causes for the diabetes. And there are lots of medications like steroids, antipsychotic drugs, diuretics. But nowadays, since the cancer is also going up, so immune checkpoint inhibitors are also causing the diabetes, and the patient are going for renal transplant. There are drugs like tacrolimus can also cause diabetes. So these are some of the risk factor or causes for the diabetes, James.
Thank you very much. Let's explore the complication of diabetes. Dr. Sangeeta, what are the major complications of diabetes, particularly for oral health and other systems like the kidneys? How can integrated primary care and oral health screening help identify this risk?
Yeah, thank you, James, for this question. And just to follow up how Dr. Robin has mentioned that so many disease conditions can result in the complication could be diabetes. Similarly, diabetes, if not well managed, can lead to serious complications. Prolonged high blood sugar levels can damage the heart, increasing the risk of cardiovascular diseases like heart attacks and strokes. It can also cause neuropathy or nerve damage. The kidneys are also at risk. Diabetic nephropathy can progress to kidney failure, sometimes requiring dialysis or even a transplant. And importantly, diabetes can damage the eyes, leading to retinopathy and potential blindness. But what's less often discussed is how diabetes affects oral health. Periodontitis or gum disease is the sixth complication of diabetes, apart from the other well known five, suggesting that screening for periodontitis could serve as an important adjunct in identifying diabetes related complications. Poorly controlled diabetes can increase the risk and severity of periodontal diseases. Conversely, periodontal infections can make it harder to control blood sugar levels, creating a vicious cycle. Think of it as a two-way street. Each condition can influence the other, making management more complex. For community health programs and public health professionals, this means integrating oral health into broader chronic disease prevention strategies. Recognizing Recognizing the major complications of diabetes across multiple systems and understanding how they interplay highlights the importance of a holistic, integrated care approach. Early screening, collaborative management, and community based prevention are important for improving outcomes and quality of life for people living with diabetes. Thank you, James.
Thank you very much. So these are very important complications that if you don't take care, will destroy the entire family and the individual. So I'll come to Prof. Robin. How can we cope, especially for those who are living with diabetes? How can they have some coping mechanisms that they can adopt to reduce the negative impact what Dr. Sangeeta just mentioned will have on their health? How can we better manage patients in pre-diabetes stage from developing diabetes, especially in lower middle income countries like Ghana, where I find myself? Thank you.
Yeah, thank you, James, for such a wonderful questions and day-to-day occurring questions. So one question you asked in previous part was, how do social determinants like income, education, SS also cause diabetes risks? So then in answering that question, I would like to say like countries like Nepal, Ghana, or Southeast Asia, which are the low middle income countries, there are low education, there are limited access to care to the diabetes, physician or diabetes care are linked to high risk of diabetes and expressing worse outcome because they are not able to afford the healthy foods and manage the stress properly, and because of low health literacy and less consistent medical care. So these were the some of the social determinants. And now another question which we have asked, how to cope of the coping mechanism the diabetes individual can adopt to reduce the negative impact of diabetes on the health. So what might be the negative impact like? So they can have a physical problem, they can have emotional and stress problem, and they can, so for that, how do they cope? So for physical health problems, they can cope by maintaining a healthy lifestyles. They have to focus on eating healthy foods. They have to follow the ADA diabetic plate method. They have to see the portion of the food, have less amount of carbohydrates, around 40 to 50%, or if you can 30%, and more amount of green leafy vegetables, fruits they can have little amount, and they can have a protein like 20 to 30%. Another is they have to be physical active. So what do you mean by physical active? They have to at least walk for 30 minutes a day, according to the age. If the patient is more than 80 years, they cannot do a heavy physical activity 90 or 100 minutes or 150 minutes a week. They can do some brisk walking, normal walking, yoga, stretching, mental relaxation like that. If you and you have to target the heart rate. So you have to minus 220 minus age, and that should be a maximum heart rate. If you are less than 40 years of age, you can do a vigorous, moderate intensity aerobic exercise 2 or 3 times a week, and you can have strengthening and deep breathing and stretching exercise also. So, and in form of swimming, walking, dancing, anything. So it is a choice. You have to give the choice to the patient. And more importantly, they have to monitor the blood sugar regularly as per the guidelines. So we do the A1C every 3 monthly, fasting blood sugar or other complication parameters they have to do once a year, and fasting and blood sugar every month if blood sugar is not controlled. And if it's controlled, you can call them with fasting postprandial A1C every 3 months. And they have to take a medication as prescribed by the physician or general practitioners, and regular checkup, monthly complication checkup, as Dr. Sangeeta have already told you. And most important neglected part is emotional and stress management. So nowadays, everyone is in stress, everyone is busy, so they have to sleep at least for 6 to 8 hours, as that mentioned in ADA guideline also. So you should not sleep more than 8 hours, or so you should not sleep less than 6 hours. So you have to prioritize the sleep, you have a good quality of sleep, and manage the stress. So you have to have a relaxation technique, yoga, meditation to manage the stress, or you do a walk which you make you enjoyable, laugh, or like that, and take a break and set a limits. So you should not sit in one place like we are sitting for now 1 hour. Actually, we have to sit for 30 minutes and get up and walk like that. So you should not stay in one place for 30 minutes. You should not be physical inactive. If you ever, you have to do 10,000 steps per a day. And we have to find a positive outlet, like engage in hobbies like movie, swimming, like that. And most important is the social and family support. And now this year, November 14, World Diabetes Day theme is to treat the diabetes with the social support, the social work. So that is very important. So talk about it openly with the doctors, your family, your friends. Seek the family support, doctor support, and the social support, and focus on what you can control. So this is how these are the coping mechanism.
Thank you very much. So two things I picked. One, we should reduce our stress level. And number two, we need to get a good social support to help us. Now we'll look at the prevention of diabetes. So I'll come to Dr. Sangeeta. What practical steps can individuals, families, and communities take to prevent or delay diabetes? How can public health initiatives and community-based interventions also support in the prevention of diabetes among us? Thank you.
Yeah, thank you, James. And a lot of it has been covered by Dr. Robin on individual levels and the coping mechanisms. But just taking forward from this, so prevention requires a comprehensive multi-sectoral approach involving individuals, families, communities, healthcare providers, and government. Individuals and families can prevent or delay diabetes by adopting healthier diets, engaging in regular physical activity, maintaining a healthy weight, and undergoing screening to identify the risks early. Communities can support these efforts by creating environments that encourage active lifestyles, for example, safe parks, walking trails, and community exercise programs, and providing education on healthy habits. Public health initiatives and community interventions can amplify these efforts through awareness campaigns, accessible screening services, and culturally tailored programs that address local needs. And finally, policy changes by governments, such as promoting nutritious food options and physical activity, friendly urban planning, and are very crucial to create supportive environments for prevention. Over to you, James. Thank you.
Thank you very much. We're almost through, but there's some few questions I want to ask. One to Prof. Robin on how we could help professionals, including patients, including nurses, dentists, and community workers, collaborate more effectively to prevent diabetes and its oral health complications. If Prof. Robin can answer this question. Thank you.
Yeah, Dr. James, for a question, thank you very much. So diabetes cannot be treated by one physician or any general practitioner alone. It is a teamwork. So the teams means like it can range from helper, health aide to dentist. So it is a diabetes global epidemic, it affects all the parts of the body. So we require all the healthcare professionals, not only dentists, nurses, or community health workers. We need everyone. So we can collaborate with each and everyone to prevent the diabetes and its oral health complication, especially by establishing integrated care models that can include a shared electronic health records. So nowadays we are in the era of AI. So we can have a apps that we can share with the patient party, and we can make a group with the diabetes patient, and we can share the problem, the sugar report, and reply that. So that way we can go with that, and we can have regular team meetings like we are doing now, and consistent interpersonal communications. That is very important. We have to listen to the patient, and key action includes medical professionals referring at risk patient to the dentist. So we have to refer to dentist if they are having oral problem. If they are not having oral problem also, we have to at least have their oral check once in a year or 6 months. And dentist and nurse education patient, we have to educate the nurses also for that, and community health workers for providing, supporting, and linking patient to care and resources in the community. So education is the main important thing, and the communication. Thanks, James.
Thank you very much. And thank you so much for joining us, Prof. Robin and Dr. Sangeeta. And this brings us to the end of our conversation. We could have had more discussion, but for the time we have, let me ask Prof. Robin, we just spoke now. Let me ask Dr. Sangeeta first to give us her last comment on this important topic as we bring the conversation to an end. So, Dr. Sangeeta, your last comment.
Yeah, thank you, James. So just to summarize what we've discussed today, from my perspective, in conclusion, what is most crucial is to understand this connection between diabetes and oral health if we want to advance it as a public health intervention. And the complications of uncontrolled diabetes are compounded by oral health problems like the gum disease or with the shared risk factors with dental caries. Recognizing these links emphasizes the importance of integrated primary care and oral health screening, enabling early detection, comprehensive management, as well as helps in prevention of severe outcomes for both the conditions. By integrating oral health into chronic disease prevention and leveraging community resources, public health initiatives, we can aim for improving health outcomes, reducing disparities, and enhance the quality of life for populations at risk for both the conditions. Thank you.
Thank you very much, Prof. Robin, your final comment.
Thank you everyone for inviting me in such a good podcast. So what I want to say by concluding now is that we have to, as a physician and general practitioner, we have to focus on the control of diabetes and complication. That is our job. But beyond that, we have to have a teamwork along with the dentist, and our Dr. Prajjwal is also here, community medicine expert. So we have to focus on the early intervention. We have to focus on prevention of diabetes rather than the diagnosis and treatment to decrease the global burden of epidemic of diabetes. So for that, we have to focus on prevention, education of diabetes to school children, adolescent, everyone, and we have to teach, or we have to educate the community-based program and community health workers so that they can spread the screening of diabetes, awareness of diabetes prevention, and decrease the burden of diabetes in the community, country, and as a whole world. So I would like to focus more on the preventive rather than the diagnostic and treatment strategies.
Thank you very much. So for our discussion today, we've looked at diabetes, how it's linked to oral health. We look at the risk factors for diabetes. We look at the complications of it, its management, also how we could get health practitioners and also everybody within the community to participate in reducing the burden of diabetes in the world. Let me say thank you so much to Dr. Sangeeta for making time to join us, and Professor Robin Maskey for also making time to join us. It was a nice time having this discussion. And this will bring us to the end of today's episode on bridging diabetes and oral health. Let's look forward to the knowledge we have acquired, and let's have can use this knowledge to impact our work as health professionals and those who are not health professionals, how it can affect the way we live our lives. Thank you so much for joining us, and thank you so much to Prof. Robin and Dr. Sangeeta once again. Thank you very much.